We are live.
Good evening, everyone. Welcome to our very first African American Task Force Health and Welfare Subcommittee meeting. I am State Representative Melissa Minor Brown. I represent the 17th District in Newcastle, and my co-chair will introduce herself.
Good afternoon, everyone. I am State Representative Kendra Johnson. I represent the 5th Representative District, which is a little bit of Bear, Newcastle, as well as Newark. I am so pleased to be here with you all this afternoon as we embark upon this amazing journey of discovery. Thank you all for lending your expertise and your passion to such a needed discussion and path forward. I look forward to working with every last one of you. So thank you for being here.
Thank you, Rep. Johnson. We are going to go ahead and get started. If we could move on to the next slide, please. We're just going to discuss the purpose of this very important subcommittee, which is to study, among other topics, healthcare inequities, including mental health, and also just to identify areas of racial disparities within our state when it comes to healthcare, the delivery of healthcare, mental health, and there's so many other topics that fall under that, and then to implement solutions and possible policies to help close those gaps and improve the overall health of African Americans in our state. If we could move on to the next slide, please. Okay, so here we are going to introduce our subcommittee members. If we could go around the room or around the Zoom, as you would call it, and if everyone could just introduce themselves and identify the organization that they are with. We'll start with Nikisha Williams-Bailey. Nikisha, are you there?
I've been on Zooms all day. I'm sorry. Good evening, good afternoon. You don't have to do Nikisha Williams-Bailey. It's just Nikisha Bailey. Williams is my middle name. It's not hyphenated. So happy to be here. You see that I've represented a lot of different organizations, but I don't know if you want me to list them all, but clearly I'm the Vice President of Sigma Gamma Rho Sorority Incorporated, the Middletown chapter. I clearly represent the Route 9 corridor with Canaan Baptist Church, a member of National Coalition of 100 Black Women Delaware chapter, and it can go on and on. But I'm just happy to be on this subcommittee, truly a fan of Representative Johnson and State Rep Melissa Minor Brown, and anything they want me to do, I'll follow.
Thank you so much, Nikisha Bailey. We'll get that fixed for you. Do we have Colleen Davis on the Zoom? You could introduce yourself.
Yes. Hi. Hi, I'm the state treasurer, and there's not a whole lot to say other than you have a very impressive subcommittee membership, and I'm happy to be a participant and happy to take part. So thank you so much for including me, and for everyone who's here today. I really appreciate your presence and your contribution.
Thank you so much for being here. Next up, Keith Hunt.
Pardon me. Again, my name is Keith Hunt, and I'm representing the Delaware Department of Human Resources and all of the resources that we can bring to bear to this conversation and solutions. And particularly my job within the department is a director of diversity and inclusion. And I bring a long background of working in private industry in large system change management. And this is certainly a change management process. So whatever assistance I can provide, I'm happy to be here on such an important topic and subject and endeavor. Look forward to working with everyone on the subcommittee.
Thank you so much for being here. Forrest Watson, I'm not sure if he has joined yet or not.
Representative, he just joined. I am promoting him to a panelist, so it'll just take a few moments for him to be able to speak.
Okay, we'll come back to him. Cassandra Coates Johnson, or is it Cassandra?
It's Cassandra, you got it. Good evening, everyone. Thank you to Representatives Minor Brown and Johnson for pulling this group together. I am the Associate Deputy for the Delaware Division of Public Health under the Department of Health and Social Services, and an array of public health programs fall under my line of authority: maternal and child health, health promotion and disease prevention, rural health, among other areas. So happy to be a part of these important discussions, looking forward to identifying actionable solutions that'll actually be impactful for African American populations for future generations, and also happy to support in data if needed as the committee moves forward as it relates to understanding some of the inequities that exist in our state right now.
Thank you. Thank you so much for being here. Ms. Debbie Harrington.
Good evening, everyone. I am Debbie Harrington, and I'm a community advocate here in Middletown, Delaware, of Newcastle County, and I am excited about this subcommittee and what we're gonna do as a committee to just improve things for a community that really needs that. So I'm excited, and I'm looking forward to what we're gonna do in the future.
We're excited too, and thank you so much for being here. Simone Philpotts, we have someone filling in for Simone. Kyle Shepard.
Yes. Good evening. Good evening. Kyle Shepard here. I provide staff support to the Metropolitan Wilmington Urban League. For those of you who may know Ms. Simone Philpott, she's a woman of many hats, so she's fulfilling another role at this moment today, but really looking forward to seeing how the Metropolitan Wilmington Urban League can be of support to this work and its partners here and its agencies in the advocacy and the research and just the everyday practicality. Looking forward to be an asset however we can. Thank you.
Thank you so much for being here. Eleanor Kiesel.
Yes, hi. Thank you, everyone, for being part of this, and I'm honored to be part of all of the people that are involved in this. I am an associate professor and MSW program director at Delaware State University and Department of Social Work. So the initiatives and the issues that we're going to be looking at are near and dear to my heart. Prior to coming to Delaware State University, I practiced law with community legal aid as managing attorney in Kent and Sussex County, and saw a lot of the issues that need to be addressed and conditions that hopefully we can make some recommendations. But as I said, I'm honored to be with you all and looking forward to working with this group. Thank you.
Thank you. Thank you for being here. Carmen Jordan Cox. You're muted. Carmen, you're muted.
There we go. Thank you. Thank you, Representatives Johnson and Minor Brown, for welcoming me to this subcommittee. I am a retired university vice president and a retired justice of the peace and magistrate. Like Nikisha Bailey, I'm also a member of Sigma Gamma Rho sorority, the Alpha Nu Sigma chapter. You can see she's got the hey going there. I also teach at Wilmington University. Perhaps a unique personal characteristic, which I think is apt for this particular subcommittee, is I have 4 generations of physicians in my family.
So I have a lot of feelings and thoughts about healthcare and community-based healthcare. So I'm welcome the opportunity to serve on this committee and look forward to working with each and every one of you. Thank you.
Same here. Thank you so much for being here. Next, we have Ms. Ray Jones Avery.
Greetings, everyone, and thank you, Representatives Johnson and Minor Brown. I'm representing the National Coalition of 100 Black Women's Delaware chapter, where I serve as the president. We are one of 59 affiliates across the country, so we're excited to bring both a national and a local perspective to this work. Currently, our local chapter is engaged in a statewide study of the lived conditions affecting Black girls ages 10 through 19, supported by our honorary chair, Cassandra Coles Johnson, and the Division of Public Health. So at an appropriate time, we'd like to share a little later on in the process some of our preliminary findings. Thank you.
Thank you. Thank you for being here. Next up, Ms. Gloria V. Rodriguez. Are you here? Okay, we'll come back to Ms. Gloria V. And Mr. Forrest Watson.
Okay, hi everybody. Let me see, I'll get my video popping. Let's see, is it working?
Yes, it's
okay,
working.
Great. All right, great. What are we doing, introductions?
Yes.
Okay, I was a little late and I thank y'all for y'all's patience. I'm Forrest Watson. I'm Executive Director of the Life Health Center, just a concerned citizen. I spend a lot of time sitting on committees, really about health equity, health disparities, eliminations among our African-American and Brown communities, and just basically decided to get into the delivery of care and get off the sidelines and just really get into the action. And really hopeful of change and some of the things that we need to go to in the deeper root levels. I'm willing to do that work, willing to confront those issues, and willing to have those difficult discussions.
Thank you, Mr. Watson. Thank you for being here. Do we have Gloria V. Rodriguez on the Zoom?
It doesn't appear that she has joined yet.
Okay, so we will move on. I'm gonna actually go ahead and turn it over to Representative Kendra Johnson.
Wonderful. Thank you, Representative Minor Brown. So at this point, we left this particular slide blank because we wanted to have a little bit of conversation. But before we actually started with the conversation, we just wanted to share with you some of our high-level thoughts as it relates to deliverables. Before I actually start that, I will say, you all made my heart very happy and it jumped for joy, even though you couldn't tell when I heard people talking about data and research, and I'm like, yes, that's what I'm talking about. So that is the segue into our deliverables. So for those three individuals who talked about that, you can best believe we will definitely be calling on you for your expertise. Deliverables. We imagine that each of us have particular interest in a subject or multiple topics based on our expertise and possibly even our personal experiences as it relates to change, as it relates to what we hope to see come out of this subcommittee. While all of that will be welcomed because it is necessary, we will follow the data. We will identify, evaluate, make recommendations for systemic change, changes in policies and practices, and possibly also legislation. We hope to shape and foster better outcomes for people of color here in our beautiful state. And what we know is this: we want the data. We want to allow the data to substantiate our claims and our recommendations and our path forward, because we know that a lot of us feel here in our heart and in our gut, the need for change, but we also want to make sure that it is all rooted in data and research, and it will allow us to substantiate whatever comes from this great subcommittee. So we wanted to open with that first. It's very broad, like I said, but it also does set the groundwork for how we move forward. And we also wanted you to know this: we are not coming in with the notion of we already know the end game. We are coming in with, we're going to look at this, going to evaluate it, we're going to follow the data, and from that, we're going to make recommendations. So at this time, and perhaps we can use the raise hand function, and I will ask our support to help us identify who is raising their hand. So our subcommittee members have an opportunity to share with us briefly how they see our deliverables, or what they have thought about knowing that this meeting was coming and that it is just the beginning of some really hard work. And only if you'd like to speak. I don't want to put anyone on the spot, but if you have some thoughts about our deliverables, and if you have some thoughts based on what I just shared, please feel free.
Well, if I could just step in really quick and say, thank you, Representative Johnson. And let's be honest, the other reason we left this slide blank was because we knew that it would sound better and feel better if we heard it coming from you. So thank you for that. I felt it over here, okay, in this district. So thank you so much. I'm going to go ahead and press mute now to allow for questions, comments, concerns, ideas from the subcommittee members.
So I'm looking for my raised hand. I don't want to be out of order, but I didn't see my raised hand. I'm gonna talk anyway. But anyway, again, I'm Debbie Harrington. And so, just some thoughts about the mental health, and as people go on, I'm sure I have some other thoughts about things as well. But right now I'm thinking about how we can do something for how we can figure out what's needed in the community in terms of mental health for people who are not just substance abusers. So in some of the mental health programs in Delaware, they are geared around substance abuse. And not every person with mental health issues are abusers of substances. And so what programs where are those programs, and how do we get those the members of the community, how do we get the community connected with those kinds of programs? So if you go to a behavioral health center, when you get ready to go out, they connect you with a substance abuse program. But if you are not a substance abuser, then what do they connect you with? And so I think, and then some people don't even go into, perhaps they don't even go into the mental health program, hospitals or healthcare system, because they already know that there is nothing that's there for them that's not connected to some kind of substance abuse. And so that's one issue that I am thinking about. I think we have to address mental health issues aside from just those mental health issues being provoked by substance abuse.
Thank you so much. I'm sorry, Rep. Johnson, were you going to say something?
I just said thank you, Debbie.
Yes, thank you so much. And you're absolutely right. There is this behavioral health, there's a huge umbrella, you know, and there's so many different areas underneath. And how do we even get, and now see, now the dialogue is starting, but how do we even transform that and remove that stigma so that behavioral health is not seen as an issue or a problem, but more like a chronic illness or like diabetes and high blood pressure? Why is behavioral health in a whole different category? So that's something we even have to look at. Thank you so much.
Yeah.
Hunt has his hand raised, I think. I'm not sure if your hand is raised.
Yeah, that is correct. I was looking for the hand wave feature on the screen. I couldn't find it. So thank you for acknowledging me. I wanted to piggyback on both your comments from the perspective of maybe helping to set the table for some the community folks. One of the things that historically, at least in my life experience, working on subjects like this, has always been the notion in the Black diaspora and African American community of the concern, fear of airing dirty laundry. And that concern, fear is mostly born out of our reality, if you will, of the stereotypes that overshadow our humanity and our community. And so we tend to not want to air dirty laundry because it reinforces the stereotypes of us as a community. And I would dare say that if you don't get at the dirty laundry, then you don't go about cleaning house the way you really should. And so I would like to put forth that one of the elements that surround this whole notion of dirty laundry that we must acknowledge that's in the room is the systemic racism. I was in conversations here inside of the state with one of the cabinet secretaries, and he said that, hey, you know, now that we've pulled the cover in America regarding systemic racism, it's painfully obvious that Black and Brown communities and folks, because of systemic racism, have not had the same kind of head start in life, if you will, generationally, as their white counterparts in America. That's why we have disparities in healthcare, disparity, wealth gap, et cetera. And so when we talk about dealing with this subject, we have to acknowledge the impact that systemic racism has had in terms of creating the environment, if you will, around the behavioral health and mental health kinds of issues that exist in our communities. And there's no easy answer or root cause to them, but most of us would dare say that anecdotally, we know that there's a intersection of things that have brought to bear the behavioral health issues that we find in our community. So I would urge our audience and participants to be mindful of airing the dirty laundry, not let that hold us back. Put things on the table so that we can look at them clearly. And as Representative Johnson said, get the data that backs up the discussion and the argument so that we can come forward with solutions that really are sustainable change initiatives that we can carry forward from this point forward. So I just want to share that perspective with the audience in terms of your commentary that you may make. Thank you.
Carmen also has her hand raised.
My comment was really in reaction to Debbie's, but it's not unrelated to Keith's. And I think that COVID really is bringing forth the need for us to put greater resources into mental health unrelated to substance abuse. I mean, I hear this all the time from people who might normally have not thought that they were going to have a mental health need, but I think that we're going to have increasing we have now and we'll have exacerbated mental health needs for the society as a whole. And I think that that's going to require the state to seriously consider putting more and more resources into that area. Yeah. So which in some ways, yeah, it may help with the issues that you're talking about, Keith, because it may help to destigmatize, because everybody is suffering, is really, in many ways, I think if we sit in the quiet of our own rooms and look in the mirror, I think we all are going to be struggling with some form of mental health issues surrounding COVID, things that we you know, the longer we live under these conditions, the more unhealthy it is for all of us. So.
And Carmen, if Eleanor, I know you want to get in, I just want to follow up, Carmen, your word destigmatize is a very important word in this conversation. And that in recent years, substance abuse has now become destigmatized. When it was impacting Black and Brown communities, it was seen as a pathology. Now it's destigmatized. And so hopefully that empathy and humanity can continue to carry forward in this conversation and not continue to brand it as and stereotype it as dirty laundry, as a stigma. So let's make sure that we're being fair and balanced in our conversation about this. And I just want to make that point. That's a very important word in terms of destigmatizing. Thank you. Eleanor, I'm sorry.
Yeah, oh no, not at all. That's great. Because it was really a lot of what you said that sparked my my thoughts. You know, this is, you know, we're saying healthcare and mental health issues, but it's really pretty broad. And I think that we probably will at some point have to decide what our priorities are going to be. I mean, when you talk about racism, I mean, you really are getting to certainly the issue of racism itself, but also the results of racism, of microaggressions, and the impact that those social determinants have on health and health issues for children as well as adults. So it's, I'm glad that we're looking at data, because that really is the strongest argument that we're going to have in terms of policy change. But also, I think it's important too to look at practice-based research. You know, what are we seeing in terms of health and mental health care? I love this. The first thought out tonight was the fact of mental health conditions that are not linked to substance abuse. Substance abuse is a huge issue, but it does seem as if we're lumping that all into one area, substance abuse as well as mental health. But I think at some point we've got to look at how we're prioritizing and what we're going to prioritize in terms of really doing a deep dive. Thanks for letting me share.
Okay for me to speak? I wanted to really pick up on Keith's point and kind of implore this group to really think about focusing how we frame looking at what our recommendations coming out of this work to be rooted in things that will work to eliminate and reduce the impacts of systemic racism, right? So I'm someone who looks at data all day, every day, and I'm happy to bring some of the depressing data that I am mired in on the chronic, disease side of the house. And what I'll say is, when we start to look at some of this data, I don't think, whether it's on chronic diseases, whether you're talking about infant mortality, whether you're talking about community violence, whatever indicators you want to bring forward, you'll see that the disparities are with our Black and Brown communities, and most disproportionately impacting African Americans. And so, as we look at this data, it's not just for somebody who looks at it daily. It's not going to help us narrow down our field because there's so much inequity in the African American population here in Delaware, specifically across so many different areas related to health, but from the research that I've done, it's all ties back to systemic racism as the root cause. So I just wanted to put that out there.
Kyle has his hand raised.
Yes, thank you. I just wanted to offer a quick comment in support of when we talk about prioritizing. I'm wondering how this group can just make sure that we're in alignment with the other work groups of this specific subcommittee, as well as any other efforts that may have come out of recently out of like the Justice for All agenda, as well as I think this season, the Pandemic Resurgence Advisory Committee had just wrapped up its report with a few people on this call or in this network have contributed to as well. So I'm think whatever we can do to make sure that the deliverables and the alignment and the priorities are also in echo, if they're rooted in sound foundation, that they're also just alignment with other conversations and other recommendations, so that especially as we think about when session opens back up again, that we have something that's really collaborative and supportive in each area, and that they speak to each other and that there's a relationship. Because we do know, as we just talked about social determinants of health, that it intertwines and there's an intersection within a lot of everyday life, not just at the individual level, but population level results and systems-based approaches as well. So I just want to offer a quick comment, just saying, just being supportive and thankful for this group, and hopefully that whatever is agreed upon for this specific subcommittee, that it also wields conversation with what is taking place in the other committees, to make sure that as those results and report is finalized, that they're in relationship with each other.
Kyle, thank you for your comment. And State Treasurer, I did see you ready to jump in. I'm just going to spend 20 seconds on addressing Kyle's comment. Kyle, one, thank you. Two, I'll say perhaps you were in Rep. Minor Brown and I's earlier meeting when we talked about making sure that we talk to the other members of the Delaware Legislative Black Caucus, as well as those other subcommittees, because as you pointed out, what we know is that all things are connected. And so as we move along in prioritizing, exactly what those things are, we'll definitely be, following up with our fellow legislators as well. Because the other thing too is this, like, we don't want to duplicate our efforts. So if another subcommittee is further along on a particular issue, we may go to them and say, well, what do you have and what's going on? And that might force us to reprioritize because they are farther along on a particular item. So thank you for bringing that to our attention, and please don't show up in our meetings anymore, okay, Kyle? That was longer than 20 seconds. State Treasurer, the floor is yours.
Thank you. I think that we're off to a really great start. I wanted to offer some of my own experiences. Not everyone knows this, and I apologize. I probably should have said this when I first introduced myself. I have a background in healthcare myself as a physician assistant. I specialize in neurosurgery and emergency medicine. And then I went on to do consulting across the nation. I worked with major hospital systems to help refine the way that we deliver care. And some of those, some of those initiatives that I helped to start at certain times feels like you're trying to boil the ocean. And we don't, I think everyone is sort of, spelling this out, that we don't want to boil the ocean. We realize we won't be successful in doing that. And a lot of the work that I was able to achieve was to sort of break down silos, to help change culture. And have more of a systems-based approach. And I love that everyone is identifying that this is the kind of work that needs to happen. One of the things I think about when we talk about systemic racism is creating a culture change at the center where we deliver healthcare. And just again, just based on what everyone is saying, it sounds like that is a big part of what we may want to be driving toward. And I would love everyone's sort of feedback on that as well. But just my 2 cents there.
Well, this is Keith, State Treasurer, and I would piggyback what you said, particularly the to Cal's point of narrowing things down, and I think that the point of entry that our citizens take to get health care, and I would dare say maybe some of the barriers that they face and hurdles they face in accessing healthcare, whether it be mental health or substance abuse or whatever form that may take, is certainly one of the systemic or systems pieces that we should take a look at. We know that even as we try to do that, we've got to get a cogent argument around what impact result we're looking for to achieve with that. But I do believe that that door is one that we should stand up as one of the areas we narrow down the conversation to. But to Cassandra's point, we do have to gather data around the total picture as best we can. It being so systemic, we could spend a year just gathering data around the total picture. At some point, we got to know when to stop. And I always say in my change management work, I don't worry about being 100% correct. I focus on being at least 70% correct, nominally 80% correct. So if we're 80% directionally correct, the other 20% will fall in line along the way. So I would like for us to take the 80-20 rule as we try to define our scope of this work as well. Thank you.
Thank you both for those comments. Are there any other questions? Well, let me just help everyone see on their screen. So the raised hand icon is not there, but if you tap on participants, once you tap that and you look at the bottom of that little box that shows up, it says invite, mute me, and raise hand. You're not alone. I had to find that myself, and Kyle does have his hand raised. So go ahead, Kyle.
Absolutely. I was somewhat just testing it out again too. But another quick question that doesn't need to be answered now is thinking about Delaware has the features to be able to connect up and down the state rather quickly within networks. And that has its situations that we need to navigate around. But we spoke a little bit about what the legislative Black caucus is here at the state level, but I just wanted to echo thinking about the proximity that we have to our federal delegation as well, and just encouraging conversation that may take place to really think about those champions and where they currently stand on specific things and what tapping in at that national level may look like to understand that we're also not alone being as a state experiencing some of the things that we are. So not just duplicating things within state, or within house, but what do things look like at the broader landscape as well? And if there's work out there taking place to really tap into those champions at the federal level as well.
Thank you. That's a great idea. And maybe for a future meeting, we could invite our federal legislators to give us an update on what's going on in DC. Any other questions, concerns, comments, ideas?
Keith has his hand raised.
Just jump right in there.
Okay, all right, thank you. I want to piggyback on Kyle's comment, and not only in terms of the federal, but also up and down the state, look at our possible business partners and collaborators in this, particularly the insurance companies whose whole sole reason for being and core of their business is collecting data. They know more about the life cycle of individuals and communities than any of us do, because that's the way they make their money. So if we can begin to tap into them as collaborators around our data collection process, probably make our life a lot easier and our process a lot smoother and quicker as well. So I would certainly urge us to look into healthcare providers. I know that within the state of Delaware, our Department of Human Resources handles the healthcare benefits of over 125,000 lives, but that's within the executive branch. But we're talking about the state writ large. That's when the private industry and private community can come into play to help us with this data gathering process as well. They have a ton of research that we should be able to tap into.
Thank you very much for that, Keith. I wrote that down and I totally and completely agree. Do we have any additional questions? I don't see any hands up. All right, then I assume we are ready to move on to our next slide. Future meetings. Oh, this is so exciting. So we have to go to my notes. Here we are. We have already decided that our next meeting will be on October the 29th. What we did not decide was the time. We thought that we would get this meeting scheduled, and once we were in this meeting, we would ask for your feedback to say, hey, does this 5:30 time work for you? And if it does, then perhaps on the 29th, we have the meeting at 5:30 again. But we didn't want to just make that decision. We are a team, so we want your feedback. We want to make sure that these meetings fit everyone's schedule for as much as we possibly can.
If I may, I think that not only for us, but also for the community in terms of consideration of the 5:30 time slot. As things go, I'm constantly robbing Peter to pay Paul as far as daytime and schedules and meetings. So the 5:30 slot is far enough out in time that I can manage my life around it. But I also think the 5:30 slot allows community folks who have day jobs but are involved in community to participate in this process as well. So the 29th is a good date, and I would say the 5:30 time slot holds up for those reasons I just cited.
Wonderful. Thank you, Keith. Representative Minor Brown and I thought the same thing, but still, we're a team. So we're going to put it out here and ask the questions. Any additional comments?
I would just agree. Yeah, I would just agree with Keith.
Okay.
That, in the evening, as we want, public comment and community participation, that this time probably works well.
Wonderful. Thank you, Cassandra. Any others? Okay.
I agree as well.
Say that again, Nikisha.
I agree as well. 5:30 is great. Thursday's excellent.
Oh, well, see, now you've taken the next question, Nikisha. It's okay. It's good. So our next question was, does Thursday work for everyone? We already know that it works for Nikisha.
This is Ray Avery. I'm sorry, I'm not finding the raised hand. I have I know you're not going to find a perfect day, but I just want to be transparent. Thursdays are not good for me. I have standing board meetings, school board meetings, Reading Consortium meetings. Everybody set their dates for Thursdays. So if I have, I will try to participate as I can. If you stick with Thursdays, I just want to be upfront about that for me.
Yeah, I would add that Wednesdays are a better day for me. Thursdays are not a great day, but if that's what if that's what works for the majority, I'm certainly willing to try to make as many as I can.
Yeah, this is Eleanor.
Eleanor, I'm sorry.
Oh, go ahead. Sorry.
I was just gonna say Wednesdays work for me. That's all I'm gonna say,
Yeah.
Go ahead.
Yes, I have about 4 other board meetings or different group meetings on Thursday night. And so I just kind of hoping that if they're not all on the same 4th Thursday or 5th Thursday of the month.
So
I will say I'm flexible with Wednesday, long as we're in Zoom world.
Yeah.
When we come out of COVID, I don't know about anybody else, but Wednesday night I'm in Bible study.
yeah,
Okay.
Wednesdays can be a challenge for me because I have some other meetings. So my question is, how many Thursdays a month are we going to meet? So are we trying to do one Thursday a month or twice? Right now we're looking at twice a month. So that would be one question is, what's the meeting frequency? Are you,
Oh yeah, that's good. That's good.
We ended up having 2 meetings this month because for a number of reasons. One, our subcommittee, we're one of the last groups to actually meet. And we knew that the very first meeting would be all of the preliminary stuff. So we wanted to squeeze in a second meeting where we thought we might begin to at least identify topics and prioritize so that we would have something to report back to the larger task force. So that's why we ended up having, scheduling for 2 subcommittee meetings this month. Ideally, we are thinking of meeting monthly.
Okay.
What I will add to that is that while we imagine we'll be meeting monthly, there'll still be work being done outside of those meetings. Okay. Representative Minor Brown, did you want to add anything?
Nope, you pretty much summed it up. I guess the next question is, well, Carmen, you did say that Wednesdays may not be now, is one Wednesday per month. Does that work for you?
I mean, I could, so let me first ask, are we doing the 29th? Are we definitely doing the 29th and now we're trying to find Wednesdays in future months, or we're just talking about changing the 29th to perhaps some other day? So let me get clarity on.
I'm sorry if I wasn't clear. We are definitely scheduled for October the 29th.
Okay, so now we're looking at what we're going to do in November and December.
Exactly.
Okay. So as long as I know far enough ahead of time, I can work around my Wednesdays in November and December to try to accommodate everything. How's that?
I appreciate that, Carmen. Thank you.
Yeah.
Debbie has her hand raised.
Yeah.
So the first group to schedule my Wednesday is the group that has my Wednesday. So right now, let's schedule. How's that?
Yeah, well, my question is, do we have a deadline? Do we have a date that we need to turn in a final report?
We do not have a deadline at this time. But I assume as we move, we're going to come up with things. We may have to create subcommittees from the subcommittee, depending on where we are. But at this moment, we do not have a deadline. We don't want this to extend out too far because we want to actually, have something tangible and get something done.
Right.
Representative, I may piggyback on that question. The larger task force, then what's the timeline or milestone or end date task force and in this larger scheme of things? How do we fit within that?
That's a great question, because we have to be within the time frame of the larger task force. So that will be an email sent out tonight for co-chairs.
Can I jump in for 1 second?
Yes,
Let's
please.
see what kind, because Caitlin is our guru here, and she keeps all this information in her head, unlike us. Caitlin, what do you have to offer to us regarding timelines?
Sure, thank you, Representative. So the enabling legislation for the task force requires that the task force issue its final report to the General Assembly during the 151st General Assembly. And as we know, that General Assembly is 2 years. So that does give us a lot of time. I do imagine that as we go forward, the co-chairs of the task force, Representative Bolden and Mr. Cawley from DSU, will likely want to set some shorter term deadlines for subcommittees. But as of right now, there is no hard deadline for subcommittee reports back to the full body.
Wonderful. Thank you, Caitlin. See, I told you guys, she is going to hold on to all of those nuggets that Representative Minor Brown and I can't keep in our heads while we're doing all this other stuff. So thanks again, Caitlin. We appreciate that.
You're welcome.
Representative Minor Brown, continue.
Well, if there are there any other questions, concerns regarding scheduling? I don't see any hands raised. If there are not, we will move on, and everyone should look forward to an email. We can also continue the conversation via email. Next up, we want to open this up to the public for those that are watching to ask any questions they may have. So if there is anyone that is on this Zoom who has registered, please use the raised hand function if you'd like to ask a question or make a public comment. Also, you can email African American Task Force at delaware.gov. So with that being said, I'm going to go ahead and open this up to the public for comments.
Representative Carmen actually has her hand raised. I wanted to give her an opportunity to speak.
Absolutely.
Well, it was actually, I can wait till the public is finished. There's actually a scheduling question, so I can wait.
Okay. We currently have 2 attendees in the Zoom meeting. If either of you would like to make a public comment, please use the raise hand function. Each person will have 2 minutes to speak. I don't see any raised hands as of yet.
Okay. Carmen, did you want to go ahead and ask your question?
Right. Well, we're going to try to agree upon a November date, or are you going to throw out some dates in an email and then we go from there for November, December?
I was thinking we would do that via email.
Okay, that's fine.
Your thoughts?
That's fine. I just want clarification.
Okay, is that okay with you, Rep. Johnson?
Yeah, that's fine. Whatever works for the larger group. If we want to iron it out now, we certainly have the time. It's only 6:27 and it doesn't look like we have any public comments. So, I mean, we can reduce the number of tasks that we still need to follow up on. Group, what do you all think about that? You got your calendars in front of you?
Because in reality, November probably only has a couple. I mean, we wouldn't do the 4th because it's too close to the 29th. The 25th, the 25th is too close to Thanksgiving. So I'm assuming that would leave the 11th or the 18th if we're doing a Wednesday. Does that make sense?
Yep.
That does make sense.
Okay.
Yep.
And if we want to try to space it out, I'm assuming we probably want to try for the 18th. The process of elimination.
Quick. Does anyone have any objection?
Just saying.
Nope, that's good. The 18th is good for me.
It's lovely when you have a former judge on your subcommittee.
I'm telling
I
you.
love
I
it.
agree. All right.
So want to look at December while we're at it?
Yes.
Yes, ma'am.
Why not?
You
Yeah,
have
let's get it done.
Just saying.
So moved.
So then December, I'm assuming we want to again space it out about a month. Like the 16th, we don't want to get into Christmas week, even though Christmas is not quite like it used to be.
Yeah.
So
Any objection to December 16th? Wednesday, December 16th.
So moved.
all right.
Love it, love it, love it.
Should I get a gavel?
Yes.
She got one. She got one.
All right, 5:30.
5:30, yes.
All right, see. How many emails did that save us?
Who you telling? You know what? I just want to say this is such an amazing group. I want to thank everyone who reached out and just showed interest in being a part of this subcommittee. I actually sent Rep. Johnson a message while we were having our dialogue, and I said, man, this is a great group. This is such a good group. I am just so excited to have these conversations and to come up with just something tangible, something that is really going to improve the quality of life for African Americans in our state. This is just great. I'm happy. And I know that we are going to do an amazing job. We're going to look back at this and we're just going to pat ourselves on the back because we're going to do some amazing work in this subcommittee and the overall African American Task Force as well. Thank you, everyone.
Can I ask you a technical question?
Yes.
Is it possible to add the chat feature for us for this committee, subcommittee while we're, so if we want to send a question to one of the co-chairs when we're in session, we can do that?
Caitlin?
That's something I'd have to consult with DTI on.
Okay.
But I will certainly make that ask and see if that is an option.
Okay, thank you.
Thanks, Caitlin.
Also, are we are producing minutes, correct? So,
Yes, we are.
yeah,
Absolutely.
okay.
And in that light, are we recording the sessions as well?
Yes, this is actually live right now on YouTube, on the
Okay, all right.
YouTube page. And we also have Representative Frank Cook, who is chairing the Law Enforcement Task Force. He is watching us from YouTube. So shout out to Representative Franklin Cook. Thank you for joining in. He is watching so that he can ensure that we are all on the same page here. Thank you for that.
That's so exciting. Hi, Representative Frank Cook.
I love Frank Cook.
Love him too.
So it looks like we have come to the end of our meeting. That's what it's looking like.
We love meetings that end an hour early.
I really do. But you know what? It's a testament to this group. And I don't want to sound redundant. Representative Minor Brown, she sent the text and she's like, yeah, about the group. And I'm like, yes, I am so excited, guys. I think we have a really, really dynamic and diverse group of individuals. I am excited about working with you all and getting to know you better and really looking forward to what we produce as a result of this group. So I say thank you all for being here, not only being here, but participating and just wow. I'm thinking we're going to have the best subcommittee ever. So with that, I guess we should call it a night, everyone. Yes?
Good night. Thank you for your leadership.
All right. Good night, everyone. Thank you.
Good night,
all.
everyone.
Bye.